Choices is an aged care model that aims to increase the independence of older people. Choices focuses on capacity building and the improvement of health. As clients acquire a better understanding of the aged care system and as their health stabilises, some will choose to self-direct their care. Most older people would like to remain as independent as possible. Independence is closely connected with knowledge, capacity and health. Choices enables people to build on their strengths to achieve their goals. People living in rural communities, Aboriginal communities, or those from a cultural minority may have distinctive needs. Choices caters for these distinctive needs. Take, for instance, Pat, George and Mary, who have all made decisions that have shaped their lives. They want to continue to make decisions about their care and support. Pat lives in a small community outside a regional centre. Although her husband has passed away, she wants to stay in the family home. She has arthritis and early signs of dementia and is more isolated since her son and his family moved interstate. She is not eating well and has lost weight. Pat's package is mostly spent on travel into town for shopping and visits to the doctor, with little left for help around the house. Speaking with Judy, her care facilitator, Pat tells her about the golfing trophies she and her husband won as club members. She also speaks sadly about the deterioration of her lovely garden as her arthritis worsens. In Pat's case, goal setting followed conversations about what she most enjoyed in the past and what she would like to do now. These goals were then used to motivate Pat to become more active and to improve connections with her community. Pat uses her package funds to engage a local person to assist with housework and meal preparation. Judy links Pat to a local shopping group, saving a considerable portion of her package. Pat now receives more care and eats healthier meals. Choices encourages people in the local community to involve themselves with older people. In Pat's situation, this frees up resources to be spent on care instead of transport. With Judy's encouragement, Pat reconnects with the golf club and volunteer members bring her to the clubhouse for Sunday dinners. Slowly, a circle of support is forming around Pat. After Judy's initial work in facilitating community support, club members and the local neighbourhood now look out for Pat while Judy continues to coordinate her care. Pat is self-directing at level 1. She is more involved in the care planning process. George, 74, came to Australia from Athens in the 1960s. Since his recent stroke, he lives with his daughter, Tina. Fiercely independent, he is having trouble adjusting to this. He also grieves the loss of his physical abilities and feels people are treating him differently. George and Tina meet care facilitator Helen to learn more about George's care options. George tells Helen he wants to regain some of his independence and see more of his friends. He and Helen work out a plan. Helen encourages George to talk to a continence nurse, see a physiotherapist, and take part in a restorative health program. Restorative health works both on a physical and mental level. A person's aspirational goals are utilised to motivate the person to embark on a restorative journey. After a couple of weeks, George feels some change for the better and becomes more enthusiastic. A support worker takes him to the cafe where he meets his friends. Tina now has more time to herself as a consequence. After a while, George and Tina decide they are ready to take on care coordination tasks to free up some money in George's package. They are self-directing at level 2. Mary, 68, is a respected elder in her community and holds an important position in the Aboriginal Land Council. She is often unable to meet her elder obligations because of her chronic illnesses. This causes her a lot of distress. Mary and her supportive extended family meet with care facilitator Judy and agree that a family-focused care approach would work for Mary. Mary consents to Judy liaising with the chronic illness team at the local health service. This integrated approach means Mary is supported to better manage her health conditions. Mary chooses to engage an Aboriginal advocate to liaise with service providers to ensure that her package remains culturally appropriate and sensitive to her needs. The advocate understands the complex aged care system and helps Mary and her family to see how this care package can be useful and relevant to Aboriginal elders in general. Mary feels able to recommend care packages within her community. Mary's health improves as she gains more understanding about managing her illnesses. As a result, Mary attends cultural events and meetings more consistently. Mary feels increasingly ready to take on administrative and financial responsibilities to self-direct her package. This allows for more flexibility and frees up additional resources. Mary is self-directing at level 3. Choices assists older people to lead a more independent life and to take on as much responsibility for their care as they feel comfortable with. For most people, choices will result in better health and care outcomes, more flexible support arrangements, and improved community connections. As we have seen with Pat, George and Mary, choices really can make a difference in the lives of older people.